Mr. Barry Gardiner.
In International Women's Week, I want to pay tribute to all the women who work in our health service, from chief executives and chairs of trust to nurses, porters, physiotherapists, catering staff, cleaning staff, consultants, doctors, midwives, and above all to health visitors, overwhelmingly women, because health visiting is a profession that above all requires common sense. How many times throughout the world have women turned to their families after some apparent crisis and said, "At least we've got our health"? Our physical and mental health is the bedrock of all that we do and all that we are. As an MP, therefore, I take a fundamental interest in and fundamental responsibility for the quality of healthcare services that my constituents enjoy. Interest not just in outputs, how much money or resources government makes available, but interest in outcomes, mortality rates, quality of care, speed of treatment. I must also bear responsibility, not for individual cases, but responsibility for the configuration of services, their proper resourcing and the proper benchmarking and monitoring of delivery. Northwick Park and St Mark's Hospital fall inside my constituency of Brent North, and together with Central Middlesex, which lies in the constituency of my honourable friend and neighbour, the member for Brent South, they form the North West London Hospitals Trust, which serves most people in Brent and Harrow. I'm proud to say that it is the only trust assessed as excellent for the quality of its services in outer northwest London. Last summer, I was delighted that the trust was designated as one of only 8 hyperacute stroke units for London. We've all seen the excellent public services adverts about fast, face, arms, speech, time, and I congratulate the Trust on its success in winning this key unit, which is part of a scheme projected to save 500 lives a year across London. Whilst I was delighted by the announcement, can I advise my right honourable friend that I will be even more delighted when the Northwick Park Trust is announced as one of the major acute hospitals for the sector, upgrading it still further, an announcement which I trust may come later on this year. Whilst discussing major acute trusts, though, I must comment on the intervention by the Honourable Member for Hammersmith in Fulham, who has been in the Chamber but I see is no longer in his place, who suggested that out of the 8 North West London hospitals, 5 accident and emergency departments would close. The Healthcare for London report actually talked of creating 3 major acute trusts. The Honourable Member has interpreted that as meaning 3 hospitals would stay the same and 5 would lose their A&E. In fact, the Strategic Health Authority has confirmed all 5 will keep their existing A&E, but 3 are due to be upgraded into what are effectively super providers. I trust that opposition members will now stop portraying as a cut what is in fact a proposed upgrade. There are 3 key milestones for Northwick Park Trust. 1, dealing with the historic debt that the hospital has of £21.5 million, and that will take place over the next 2 months by a meeting of the PCTs across London to agree their support for wiping out that debt. 2 is the public consultation on the future... No, I will not. On the future configuration of the sector this autumn, and 3 is the support for NHS London to embark on a hospital rebuild. The future for Northwick Park, I give way to the Honourable.
I'm grateful to the Honourable Gentleman for giving way, just so he doesn't misrepresent what is in the North West London sector document. It makes it very clear on page 54 that the local hospitals, i.e. those that are not designated as major acute hospitals, would have is that they will include a GP-led urgent care service. Contrary to what is in the NHS London document, local hospitals in the North West London document are not promised a continuing emergency department.
I don't know whether the Honourable Gentleman has had the benefit of speaking both with the Chief Executives of the hospitals and also with Ruth Carnell from the SHA. And you will find that Ruth Carnell has confirmed that there are no plans whatsoever to take away the accident and emergencies from those hospitals. I turn now to our local PCT, NHS Brent. 4 years ago, I was extremely critical of Brent PCT and was in part responsible for initiating the turnaround plan. Today, NHS Brent is one of the 2 fastest improving PCTs in the country based on the CQC performance ratings for 2008-9. In a borough that recalls 19-hour waits on trolleys in A&E under the Conservatives, it is meeting its targets of 4-hour waiting lists, and in particular has exceeded the 93% target for cancer waits of no longer than 14 days. Critically, this is not just about improved targets, it is about lives saved and mortality, not only for cancer, but also for cardiovascular disease, has vastly improved. All mortality has improved from 87 per 100,000 just 2 years ago to 79 per 100,000 now. Mr. Deputy Speaker, health inequality lies at the heart of this debate. And in Brent, if you go from the south in Stonebridge Ward, you will find that the average life expectancy is almost 10 years less than in the north in some of the more affluent wards which I represent in Brent North.
Honourable friend, give way.
Of course.
Yeah. Sorry. On that point, I tell my honourable friend that my elder brother was born 2 years before the National Health Service. He died as a child. The next brother died. I was born in the same week as the National Health Service, and I'm still here. But the key point is, surely, that there is a real confusion within the National Health Service at the moment. Doctors feel, clinicians feel, that they're not being given the space to breathe and the space to do what they do best. Does he not agree with me that there seems to be a disconnect between the public affection and respect and need for the National Health Service and this present strategic exercise, which isn't being connected up at the moment?
For Brent North continues, and I would ask him to keep an eye on the time. Can I just say to the honourable lady and gentleman below the gangway, you should not be reading newspapers in the chamber. Mr. Barry Gardiner.
Sir, my honourable friend from Ealing North makes his own point in characteristically robust fashion. I want to focus on health inequality. And it is clear that one of the best ways of addressing health inequality is through increasing physical activity, particularly in the young. And I do urge the Department of Health to invest far more than they have done in the past. They have already begun to work in this area, and the Fit for Life campaign that the department has been running is extremely productive in this respect. But I believe that much more must be done in cooperation with the fitness industry and in cooperation with sports providers throughout the capital to ensure that we address in the young not only the problems of obesity, but set up a platform for fitness throughout life which will help to address health inequalities as a whole.